I'm Dr. Paul Jared Frank, Director of the 5th Avenue Dermatology, Surgery and Laser Center. Welcome to one of my educational videos. Today I want to talk about a relatively new technology that is based on a much older technology called microneedling. The newer version of this is called the Dermapen. What people used to do for scarring and wrinkles years ago before fancy lasers and injectables is they actually used to take little fine needles or blade-like instruments and physically manipulate and break up scar tissue. This would stimulate a healing response in the skin that would, over time in multiple treatments, would make the skin look better. Microneedling eventually matured into something called microneedling rollers, where it was almost like a roller pin that would go across the skin. And again, this is all about doing subtle damage to stimulate new collagen stimulation and improve the quality of the skin. It has now been taken to the next level in 2012, 2013, and now we have the device called the Dermapen. And the Dermapen is exactly what it is. It's literally a type of pen that treats the dermis. But what's nice about this is that it has a lot more control and efficacy. Instead of just taking blind needles and poking at the skin, what we have are these disposable, very sterile tips that have, I don't know, a few dozen, I think, very small micro needles attached. And what I'm going to have you do is maybe you could zoom in on this and get a good look at what the needles look like. Okay, and it's on a tip that will be vibrating and rotating. So let's bring that back. Anyway, these micro needles are put into a battery-powered or electrically operated device, and I can control exactly how deep in the skin these tips will penetrate. So it's almost on a spring action where the needles are penetrating the skin at a 90-degree angle, at a controlled depth and a controlled speed. So instead of taking some random needling device where there's much less control of, you have something that standardizes this age-old treatment quite well. And sometimes new isn't always better, but we do find new ways of revising great old tricks. So the question is, who could use this for? Well, it's not to cure wrinkles, but we do use this on general resurfacing of the skin, fine lines. It does work very well for acne scars. It works well for traumatic scars. It does not replace lasers. I still use Fraxel technology and V-beam technology and MedLight technology, and they are still the standard of care for a lot of the type of resurfacing that we do. But for certain types of scars and certain skin types that cannot tolerate laser, sometimes it's very dark-skinned people or sometimes people who are very sensitive to certain type of light, the Dermapen really kind of gets the ball in the hole for them. What you do is you turn on the machine, and I'll do that. You can get in a little close, and you can see the vibrating tip. And again, I can control the depth. And so what you do is, I'll put it on light so I test it on myself. Okay. You literally take it, and you just go over the skin. Now I have it on a very, very light setting because obviously I don't want to cause too much trauma to my skin right now. So at most it's just going to leave a little redness. But that's what's great about it. You can do a light resurfacing treatment on the face that has the recovery of like a light spa peel, or you can very deeply treat a scar where you have pinpoint bleeding and the recovery may take 3 or 4 days. So again, we have a great novel technology of an age-old treatment, microneedling, now called the Dermapen. Just another tool added to our armamentarium at the 5th Avenue Dermatology, Surgery and Laser Center. I hope to get a lot more use out of this and share this with my patients. Thanks for joining, and for information about this and other fun procedures, check out my website, www.pfrankmd.com. Thank you.